Hello and welcome to our channel. In today's video, we are going to discuss the ethical issues that nurses encounter in their day-to-day practice. Nursing is a noble profession that requires the utmost level of integrity, honesty, and compassion. However, there are certain ethical dilemmas that nurses face, which can be challenging to navigate. To begin with, we will introduce the concept of ethical issues in nursing practice. Ethics is a branch of philosophy that deals with the moral principles governing human behavior. In nursing practice, ethical issues arise when a nurse is faced with a situation that requires them to make a decision that is not in line with their values or that goes against the ethical code of conduct. One of the most critical ethical issues that nurses encounter is informed consent. Informed consent is the process of obtaining a patient's permission to perform a medical procedure after providing all the relevant information about the risks, benefits, and alternatives. Nurses have a duty to ensure that patients understand the information they are provided and that they are competent to provide informed consent. Confidentiality and privacy are also ethical issues that nurses need to navigate. Nurses have access to a patient's private and confidential information, which they must protect at all times. They should only share this information with authorized personnel, and only if it is necessary for the patient's care. End-of-life care is another ethical issue that nurses need to address. Nurses are often involved in decision-making regarding a patient's care, especially when it comes to end-of-life care. This can be a challenging and emotional situation that requires nurses to balance the patient's wishes, their duty of care, and ethical principles. Cultural and diversity issues are also essential ethical considerations in nursing practice. Nurses must recognize and respect cultural and religious practices that may impact patient care. They must also be aware of their biases and prejudices to ensure that they provide equitable care to all patients. Ethical decision-making involves identifying ethical issues, considering the relevant ethical principles, exploring options, and selecting the best course of action. Nurses must follow a systematic process to ensure that they make ethical decisions that are in the best interest of their patients. So there you have it. Ethical issues in nursing practice are complex and require nurses to have a solid understanding of ethical principles, values, and decision-making processes. It is crucial for nurses to have ongoing training and education in ethical practices to provide the highest level of care to their patients. Thank you for watching. If you found this video informative, please hit the subscribe button below for more content on healthcare-related topics.